We have laser implant specialist Dr. Preety Desai joining us on the show this afternoon. It's great to have you back.
Thank you so much.
You're very welcome. We're talking today about the prevalence of diabetes in our society. You sent me some information, and even I was quite surprised to learn just how prevalent it is, that in the next 10 years, 1 out of every 2 adults will either be diagnosed with the disease or the early forms of it. That's quite a shocker.
That's huge, 50%.
And is that type 1 or type 2, do you know?
If it's diagnosed later in life, it usually means that you had adequate levels of insulin, but it's just not working quite as well. So that's type 2. Type 1 is basically where you have no insulin whatsoever. So usually what you're born with it.
Okay, diabetes, of course, being labeled as the disease of the 21st century. And when it comes to your gum health, you have a part to play in helping to prevent it if you so choose.
Very much so. It has been shown in long-term studies all over the world that diabetics are at much higher risk for losing their teeth, 2 times more likely and 3 times more likely to have gum disease. In fact, if you didn't even have diabetes and you had gum disease, your blood sugars go up. Your body can't even just handle that amount of inflammation. But when you have both together, it's a double doozy. They both work against each other.
When you are looking in somebody's mouth, can you tell if there is that chance for gum disease and therefore diabetes to be a factor for that person in the future?
You can. I look at gums every day. Not every dentist will look at gums. They often look at teeth as well, right? But I have diagnosed diabetes in patients who have been undiagnosed, and 20% are undiagnosed anyways. And when I am doing traditional therapy and treatment and it's not responding, that's my #1 diagnosis, to have that patient go to their doctor and get their sugars tested.
Right, and you can't say, okay, I'm going to diagnose you, but you can say, look, there are some factors here I'm concerned for you, and then you move them to their doctor.
Exactly, and often, you know, the home tests that diabetic patients do with just a little stab of the finger, I do that right in the office right away, just to get a guideline as to are we on the right path or not.
Clearly not the news you want to have to give anyone though.
No,
yeah.
Very much so.
When it comes to the age or the demographic of those that you see this in, I'm supposing that baby boomers are more prevalent, the younger generations. Do the younger generations take better care of their teeth? Would you say that or no?
I think today the awareness is definitely there, but the largest rate of growth of diabetic diagnosis is between the 30 to 60 range. And with obesity in our children now that are not as active playing video games, type 1 diabetes, where the pancreas just shuts down, is getting higher, which is actually scary.
So when it comes to good oral health, the best way to prevent being a candidate for diabetes, where would you take that? Just brushing more, flossing more? Like where?
Of course, all the common sense kind of stuff, but also studies have shown that if a diabetic patient goes into the dental office or the periodontal office for every cleanings every 3 months, the proof is that they actually almost use no metformin, no medication to control their diabetes. It controls it that well.
What are the first indicators of diabetes if somebody, I mean, you're not a doctor, okay, but you sort of see a little bit of what what's going on. What are some of the indicators that would make you, besides seeing their mouth, are there other things?
Definitely. There's a ton of systemic signs that comes from the Greek term passing urine. And urination frequently, high blood sugar means that they can be a little bit jittery, thirsty all the time, extreme weight loss, and you can almost have alcoholic breath with ketoacidosis. So if you are worried about yourself saying, my breath is, I haven't drank anything, that's late diagnosis of diabetes.
Isn't it interesting how your body has all of these ways of showing you something, but unless you know what to look for, you may go undiagnosed? As you said, 20% do go undiagnosed.
Yes, right now in Canada, that's how high it is. If you can read the paper and listen to the Midday show and, you know, just keep abreast of things in the news, that's as best as you can do as a human being. There's so much data and literature out there, it's kind of overwhelming, but, you know, giving little sound bites just to kind of keep aware of things is good.
Absolutely. Well, I really appreciate the information that you're putting along today in regard to this. Is there anything else that you would like to add about the link between the two?
I think if patients are at all worried, then you've got to get into your dentist and get a good examination, get a good cleaning. To me, a dental cleaning and a periodontal cleaning is the best bang for your buck. It's the most preventive thing. Hanging onto your teeth, you know, it means you can eat and smile into your 90s, so that's what we want to do.
Excellent reasons. All right, Dr. Desai, thank you for being here today.
My pleasure, thank you.
Information on the screen at kamloopsperiodontists.com as well. The phone number if you would like to check things out, learn a little bit more, make sure that you are staying healthy. It's important to do so. We're back in 90 seconds. Stay with us.